Hello, I'm Jerry Waterworth, a volunteer with AARP Arizona. Today we want to share some basic information to help you navigate your Medicare choices. We know that making decisions about Medicare plans can be confusing and difficult, so we've created a series of videos to help you navigate this process. Today we're going to talk about open enrollment, Medicare savings programs, and extra help. So currently, we're in an open enrollment period for Medicare, which runs from October 15 to December 7, 2021. Check your mail for important notices about Medicare or Social Security regarding changes in coverage and costs in your service area. It's also a good idea to review the new 2022 Medicare and You Handbook, and it looks like this. If you haven't yet received one, you can order one through Medicare.gov. If you're happy with your current plans, there's no need to take any actions. You can also get personalized help in the community. You might find free information and events online or from Medicare counselors in the area by phone, like the State Health Insurance Assistance Program. And we'll have their contact information later in this video. Well, so far we've covered highlights of original Medicare, including Part A, hospitalization, Part B, medical insurance, Part D, drug plans, and Medigap insurance to help cover out-of-pocket costs related to original Medicare. We also discussed Medicare Advantage plans, Part C, which offer alternatives to original Medicare. In another video, we discussed enrollment options, including initial enrollment for those turning 65, as well as open enrollment for all Medicare enrollees. But today we'll focus on getting help or financial assistance to help pay for parts of Medicare. As I'm sure you know, Medicare is not free. Part A, or hospitalization, may be free to you if you've worked for 10 years and have accumulated 40 Social Security credits. Otherwise, you can purchase Part A, but can be very expensive depending on your work history. Part B, or medical insurance, has a monthly premium of $148.50, scheduled to increase for 2022, plus an annual deductible and co-insurance of 20%. In other words, Medicare Part B will pay only 80% of most medical bills, and you'll be billed for the remaining 20% of the charges. In addition, Part D, or drug plans, can range widely depending on where you live, and that's before the cost of any drugs that you might need. So as you can imagine, the cost of these options can become significant for many of us and a burden for some who have to use these services. But to help those with lower incomes, Medicare offers some options to help pay for the cost of Medicare programs. There are several Medicare savings programs that may offer help to pay for Medicare costs if you meet certain conditions. The Qualified Medicare Beneficiary Program, or QMB, helps pay for Part A and or Part B premiums. This program also covers other out-of-pocket costs like deductibles, co-payments, and co-insurance. The Specified Low-Income Medicare Beneficiary Program, or SLMB, helps pay for Part B premiums only. And finally, the Qualifying Individual Program, or QI, helps pay for Part B premiums as well. To qualify for any of these programs, you must have income and resources below a certain level. Medicare Extra Help may also be available to help with Medicare costs. Extra Help is a program to help people with limited income and resources pay for Medicare drug costs or Part D. For example, this year, you might qualify for Extra Help if your yearly income is less than $19,320 as a single person, and if your resources are less than $14,790. Now, these thresholds are adjusted every year, and different states may have different ways of counting income and resources. So look for help if you want to pursue this option. A good starting point is Medicaid, or Access in Arizona, which stands for the Arizona Healthcare Cost Containment System. Medicaid is a joint federal and state program that helps pay for Medicare costs for those with limited incomes and resources. Some people may qualify for both Medicare and Medicaid. And for help, you can contact Access at 1-855-432-7587 or online at healthearizonaplus.gov. There are other sources to help you find out if you qualify for extra help. One very helpful Medicare resource is the State Health Insurance Assistance Program, or SHIP. You can get personal one-on-one help from counselors who've had extensive training on Medicare. They can check to see if you qualify for the Medicare savings programs or the Extra Help program. And that number is 800-432-4040. You can also contact the local office of the Area Agency on Aging for assistance with Medicare plan selection or basic information on Medicare. A contact number is 602-280-1059. And another useful resource is the Medicare website at medicare.gov. You can search plans available to you based on where you live and search for answers about help paying for Medicare services. You could also call Medicare at 800-633-4227. Access in Arizona may be reached online at healthearizonaplus.gov or by phone at 855-432-7587. And finally, you can find many answers on the AARP website at aarp.org. There's a special section with Medicare Q&A, so you can search for most of your answers there. Or you can call for help at 888-687-2277. So exploring these resources and being informed about your Medicare options will help you make the best decisions for your situation. Thanks for joining us today for this segment on getting help to cover the costs of Medicare. And we hope you'll join us for future updates on other topics of interest. Goodbye for now.